Everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Amlodipine. Its brand name is Norvasc. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Amlodipine is classified as a long-acting calcium channel blocker. It exerts its effects by blocking the influx of transmembrane calcium ions in cardiac and vascular smooth muscle. It can also reduce blood pressure by reducing peripheral vascular resistance. In terms of indications for use, amlodipine can be used for the treatment of hypertension or high blood pressure. It can be used in chronic stable angina or chest pain. And it can be used to reduce the risk of hospitalization in patients who have coronary arteriosclerosis. Now, before somebody was to use amlodipine, there is one contraindication they must clear, which in this case would just be a hypersensitivity to amlodipine or any other component of the product. And there's also some precautions and warnings that they should be made aware of. Patients with severe obstructive coronary artery disease would be at an increased risk of experiencing chest pain or angina, as well as myocardial infarctions or heart attacks upon dose increases or upon starting the medication. Patients who use amlodipine who have severe aortic stenosis may put themselves at an increased risk of experiencing symptomatic hypotension or low blood pressure. Patients who have severe hepatic impairment or liver impairment should start this medication on a low dose and increase the dose slowly. The most common side effect with amlodipine would be peripheral edema or swelling, and this usually occurs in the first 2 to 3 weeks of therapy. You would want to initiate this medication at a lower dose in the elderly population. And lastly, for precautions and warnings, it should be noted that symptomatic hypotension or low blood pressure may occur with the use of this medication. Now, once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to use amlodipine or Norvasc, they can expect to receive their dose in tablet form. It's available as a 2.5, a 5, and a 10 milligram tablet. If somebody is using this medication for hypertension or high blood pressure, they would typically start off with a dose of 5 milligrams once daily. They would then increase the dose based on the response they get with their blood pressure, typically waiting about 7 to 14 days between dose increases. Maximum dose would be 10 milligrams once daily. Some patients in certain circumstances might start off on a dose of 2.5 milligrams rather than 5 milligrams. For chronic stable angina, typically patients would use 5 or 10 milligrams once daily. And the dose would be the same when patients are using amlodipine to reduce their risk of hospitalization due to coronary arteriosclerosis. So the dose would again be 5 to 10 milligrams once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using amlodipine, so I'll go over some of those here now. Flushing may occur in up to 2.5% of patients. Up to 4.5% may experience palpitations. Up to 10% of patients may experience peripheral edema. Less than 3% may experience abdominal pain or nausea. Dizziness comes in at a rate of about 3.5%, and headache comes in at about 7%. About 1% of patients may experience somnolence, and 4.5% may experience fatigue. Now, some more serious but rare side effects would be acute myocardial infarction or heart attack, angina pectoris or chest pain, and finally angioedema. That's all we're going to talk about today with amlodipine or Norvasc. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.